Progressive neurodegenerative disorders and their definitions, deficits, and adaptations for para-alpine skiing. Progressive neurodegenerative disorders are a group of conditions that progressively damage cells and nervous system connections. This damage causes mobility, coordination, strength, sensation, and cognition to be effective. Though there are several disorders in this category, three to focus on are amyotrophic lateral sclerosis, also known as ALS, multiple sclerosis, also known as MS, and Parkinson's disease. ALS is also known as motor neuron disease, Lou Gehrig's disease, and Charcot's disease. This disease attacks motor neurons in the brain and the spinal cord, resulting in paralysis. Typical diagnosis occurs between the ages of 55 and 75, and early signs of ALS include muscle cramps in one of their arms and legs. As the disease progresses, weakness spreads through the body, eventually affecting swallowing, bowel and bladder control, speech, motor coordination, muscle weakness, and breathing. Participants often use a wheelchair for ambulation. There is currently no cure for ALS, and the disease progresses over time, often leaving participants with approximately 10 years to live post-diagnosis. MS is an inflammatory autoimmune disease that attacks the central nervous system through the destruction of the myelin that covers the nerve fibers. This causes communication problems between the brain and the rest of the body. Diagnosis typically occurs between ages 20 and 40, and typically people live another 25 to 35 years after the diagnosis. Common symptoms include numbness, lack of coordination, loss of vision, fatigue, unsteady gait, and sensory issues. Many people with MS use a wheelchair or scooter for mobility due to weakness and fatigue. Parkinson's disease occurs when the nerve cells in the basal ganglia die. The basal ganglia is the area of the brain that controls movements. When these neurons die, they produce less dopamine, causing movement problems. The cause of the disease is unknown, and people are usually diagnosed when they are over the age of 50. After the diagnosis, the prognosis is about 10 to 20 years. Common symptoms include tremors in hands, arms, legs, and head, impaired balance and coordination, and muscle stiffness. People with Parkinson's often develop Parkinsonian gait, the tendency to shuffle feet, reduce swinging arms, and lean forward. People with Parkinson's can often ambulate independently and will only use assisted devices like crutches or a wheelchair if the disease is far progressed. Adaptive equipment allows each participant to ski down the mountain as someone without a disability would. Starting in the top row and going from left to right is the adaptive equipment frequently used for participants with progressive neurodegenerative disorders. These include, first, a slider, which is like a walker with skis attached, a snow-go, similar to a ski bike except you stand and hold onto the handles, a ski bike, the participant sits and can either put their feet on the pegs or on ski blades, a bi-ski, which is a sit ski with two skis attached, a mono-ski, a sit ski with one ski attached, and handheld outriggers, which are used for sit skiing, and when they're lengthened, they're used for 3-tracking and 4-tracking. It is crucial to give these participants a great number of breaks as they fatigue quickly. Participants with progressive neurodegenerative disorders can benefit from the use of assistive devices. Due to weakness, extra chest straps can be beneficial to hold their upper extremity up and reduce the amount of energy they need to use. Active hands can be helpful for someone who has a difficult time with upper extremity control and movement and fine motor coordination. This can be used to attach a participant to the handles of a ski bike or to the handles of outriggers. A pole can be used to help the participant ski down the hill and exert less energy by giving them assistance. Progressive neurodegenerative disorders can be severe, so it is important to understand the severity of your participant's condition. Asking questions related to their deficit and level of fatigue can assist in lesson planning. Stretching prior to the lesson can benefit the participant because they will often be stiff due to lack of movement. Taking frequent breaks, keeping their body warm, and making sure they drink plenty of water are all key in assuring the lesson goes well for the participant. There are several benefits when people with progressive neurodegenerative disorders alpine ski. Staying active can slow down the progression of the disease, joint and muscular health can be improved, and the participants gain an increased sense of independence. There are several risks when someone with a progressive neurodegenerative disorder goes skiing. Their fall risk is increased, their muscles are already weak and can be damaged due to the rigorous activity, and skiing can completely deplete the participant's energy.